Already did.
Hospital in Durham is remaining open, and we're actually looking to expand services. I know many of you have come here this evening with stories to share, both of how our courageous and amazing healthcare workers have served you and your families in this community for years, and also share your concerns about the future of healthcare services in Durham. We want to hear those stories and these concerns. That's why we're here tonight, is to hear from you. Before we get to that, there's some information that we, members of the South Bruce Gray Health Center, would like to share with you. We have had a chance to meet with some of our municipalities and other groups and individuals, right? And some I see here tonight. And they encouraged us to bring that here and share that information with you. So we want to be transparent with you about the challenges that we are facing. In a moment, we will start today's session with a presentation from Nancy, our CEO, about the current status of our hospital organization and how we are planning for the future in partnership with our partners and community to provide high quality care for all of our patients in this region. Then we want to hear from you, both answering any questions you may have, but also on what type of care you want to see here in the community. We ask that you please save your questions for after the presentation. As part of this, we'll also be hoping to get your input and feedback through a community survey. We have printed copies that you can fill out during or at the end of today's session. This can also be completed online. Once again, thank you all for participating in today's session. I will now hand things over to our moderator, Joe, who will provide some ground rules for today's session.
Thanks, Steve. Hello, everyone. I'm Joe Dietrich, resident of Rockford. Thank you. I'm Joe Dietrich, I'm a resident of Rockford and vice chair of the South Bruce Gray Health Center Board of Directors. As Dee mentioned earlier, it's really important to us that we hear your input on the healthcare needs of our community. We want this to be a productive conversation. I'm sorry?
We still can't hear you.
Okay, thank you. We want this to be a productive conversation that looks to the future of healthcare in the community. In order to do so, I want to outline a few ground rules for today's session. Please maintain respect for the space and for everyone in the room. Please don't do anything that would prevent others from hearing whoever is speaking or cause any unnecessary distractions. We expect we will have at least 30 minutes today to hear from you directly and to answer any questions you might have. We ask that each person ask only one question so that we can hear from as many of you as possible. If you have a question or a comment, please raise your hand and a facilitator on the floor will bring you a microphone. Before asking any questions or providing feedback on the healthcare needs of the community, please say your first and last name and which community you live in. I will announce the last question for this evening when we're running out of time. If we do not have time to get to all questions or feedback today, you can write them on a piece of paper at the sign-in desk and drop them off in the designated box so we can address them following the session. I also want to mention that we have invited some of our community and health systems partners here today, including emergency responders. Thank you for being here. We have a large group and we want to make sure that everyone's safety is top of mind. Again, we ask that you hold your questions until after the presentation. I will now ask Nancy to come to the mic.
Can you hear me? In the back? Okay. Thank you, everyone, for taking time out of your evening tonight so you could attend our engagement session as we vision for the future of our organization. My name is Nancy Shaw. I'm the President and CEO for the South Bruce Grey Health Centre, and I'm joined here tonight by members of our leadership team, as well as members of our Board of Directors. You've got to meet Dean, our chair, and Joe, our vice chair, who will be helping out tonight. I also noticed that we have members of our staff in the audience tonight and some physicians. And I just want to say thank you for everything you do every day to keep providing high quality care to the members of our community. You are the backbone of our organization. I also noticed we have some government partners here as well. MPP Rick Byers, as well as Mayor Eccles. Thank you for joining us tonight. I just wanted to start this evening off by acknowledging the difficult time that this community has faced over the last few months. There has been a lot of fear, there's been a lot of concern, there's been a lot of anger. Understandably so, when you feel that you are going to lose your hospital. We remain committed, South Bruce Grey remains committed to providing care in all 4 of our sites, and that includes Durham. We are committed to keeping Durham open. You have a deep connection to this hospital within the community, and the decision to transition beds was very challenging and very difficult, and certainly not a decision that was made lightly. But faced with the circumstances that we had, knowing we were not able to staff both the inpatient unit and the emergency department, we had to make a decision. There are lots of concerns about healthcare in rural Canada right now, and this community has demonstrated their commitment to supporting the hospital, and we all have the same goal. South Bruce Grey Health Centre is committed to the Durham site as well. I have worked in healthcare for over 30-some years, and I have spent all of those years in rural healthcare and living in rural Ontario. As many of you have seen that are sitting in this audience tonight, you have seen many changes over 30 years. And our healthcare environment continues to change. And we have to adapt as well in order to maintain the service provision that the community needs. The hospital is at the heart of the community, and we need to remember the legacy that Durham has and will continue to bring forward in the future. We need to work with the resources we have now, and we really want to hear from our community about what service needs they feel we should bring to the community. When we talk about the reality of healthcare and the shortage of health human resources, specifically nursing staff, that's not just South Bruce Grey Health Centre, that's across the province of Ontario. Many organizations are faced with the same challenges. Some other organizations may not seem that they are suffering as much as we have with shortages of staff, but everybody has their challenges. And we are doing what we can to help maintain service in all 4 of our communities. Durham will remain open. The blue H will remain on the hospital. Right now the beds aren't there because we can't staff them, but that doesn't make it not a hospital. It is still a hospital for this community. Our goal here tonight is to enhance services. We need to continue to meet the service needs. So that is why it is so important to hear from you and have your feedback through the survey process. Where are you traveling to? Why are you in the community for health care? Is there somehow we can partner with other organizations to bring those healthcare needs to the community? There's a lot of travel outside of Durham and other sites of the South Bruce Grey Health Centre. So what can we bring to Durham to help support patient needs with the resources we have. Tonight is the first phase of communication. We want to keep the lines of communication open. We want to hear from you. That hasn't been possible before tonight, so we look forward to maintaining this as a step as we move into the future. We're going to collect your feedback from the survey process. Surveys are available here tonight in paper format, and I understand they're also going to be made available at the West Gray Municipal Office as well for pickup. And they're also available on our website. So please take the time to provide your feedback, and please be realistic with your feedback, knowing what we're faced with right now as we move into the future. Healthcare is collaborative, communities are collaborative, the hospital is part of the community. We really want to work with the community, patients as partners, part of our pillar in our strategic plan, but we look forward to working with everyone so we can move into the future and maintain service provision as we adapt to our changing environment. So with that, I think we'll move on to the presentation. So I'm going to start the presentation tonight with a little bit of background about the South Bruce Gray Health Centre, so everyone is aware of exactly what we do and how many patients and people we serve in the community. So we are a multi-site organization. There are 4 sites: Chesley, Durham, Kincardine, and Walkerton. We have over 400 staff employed across all 4 sites, and we serve approximately 44,000 people. 10,000 of those are seasonal residents, and we also have an additional 30,000 tourists that visit our area annually. So when we look at our strategic plan, and the strategic plan is going to be reviewed in 2025, we talk about our vision, and our vision is together enriching healthcare in our communities. Our mission, to provide patient-centered care to our communities through a collaborative and quality-driven culture, keeping pride, inspiring pride in the team and in our care. We work within our values. Can you still hear me? Work within our values of teamwork, empathy, accountability, mutual respect, and safety. So we have 4 pillars that we use to guide us as we work through our strategic plan, and that's patients as partners and healthy communities are 2 of those main focuses. And that's what we're doing here tonight. We're listening to our patients and our communities and striving to make the future brighter and stable for Durham. So we'll move forward now and we'll look at our current context. So where are we today? So as I mentioned in my opening remarks about staffing challenges, we are no exception. We continue to do whatever we can to recruit and retain staff. And some examples, because I know people have questions around this. We've reviewed roles and responsibilities, so staff are practicing to their full ability, and that includes scope of practice for our registered practical nurses. Participating in government strategies to support recruitment and retention, and there have been numerous ones that have been brought forward by the government, which have been very helpful. We've established a student clinical nursing program. That's the first time ever, sorry, not a program, but placement for the program. So we've never had that at South Bruce Gray Health Centre, and we started that this past year, and it was great. And we're hoping to expand now to all 4 of our sites. And we continue to market our organization to attract more nurses and physicians, but it is challenging. Despite all our best efforts, we continue to face challenges and have had to make temporary service reductions at some of the sites to ensure they are adequately staffed and can provide safe, high-quality care. So when we look at emergency departments across the region, and I know this slide is kind of small, but you can see that just the green pillars are the 4 sites of South Bruce Gray Health Centre. So on the far right is the Chesley site, and these are volumes from 2021 to 2022. Chesley site, 4,511 patients. The next green to that would be Durham, 7,496. Then we have Walkerton site at 9,601. And then we have our Kincardine site, 13,278. And the highest volume to the left is Hanover. And this is from 21-22, and Hanover's at over 17,000. And that is, we picked this data because that is when Chesley was open 24/7 the last. So that's why we chose 21-22 to look at this data. Some of the challenges we have around recruitment and retention, when we look at our smaller sites, we are more challenged to recruit to them because we have a higher population of younger staff, new graduates. They want to be in a busy emerge, they want to be in a busy hospital, they want to learn, they want to get exposed to clinical situations. We hear this feedback from them. And so understandably, that does play a part in recruitment when it comes to smaller sites. And there's less staff to go around, so they have more options to choose. When we look at staffing shortages, we have to rely on temporary nursing staff, and we continue to this day using agency staff, because one sick call in the smaller sites can trigger a closure. That's how precarious the schedule is. We can't, and we've seen closures that have resulted in one sick call. So there's no redundancy, there's no backup built into the schedule at all. That's not fair to our patients, and we want to make sure that they have access to safe, reliable, quality care. So when we look at numbers, from April 1st of 2023 to March 31st of 2024, that's what we consider our fiscal year, the Durham site experienced 45 unplanned closures, and I think this is reversed, it's supposed to be 61, and Chesley's 45, I think these numbers are reversed, but regardless, that's a lot of unplanned closures. So those are closures that resulted in sick calls that we couldn't fill, and that's why we had to close the emerge. So there's always concern when that happens to get messaging out to people that the emerge is closed, because the last thing you would want is have somebody show up expecting to get emergency care and it's closed. When we move to the next slide, we talk about patients who don't have a family doctor. Well, part of the decision around keeping inpatient beds staffed or keeping the emergency department staffed in Durham, that decision had to be made because it wasn't possible to keep both open. So knowing that there's a large population of people in the community who depend on the emergency department for their family doctor, they need to have access to care. And that is why the emergency department stays open to this day. Approximately 21%, the last statistics that we've had in West Bray, 21% of people do not have a family doctor. And many people who do have a family doctor sometimes can't get in a timely manner as well. So that's a consideration that had to be taken into account, is that we need to have access to care in the Durham community for our patients. type of patients we see in Emerge. There's a mixture. And what I mean by that is, there's a small number of patients who truly require an emergency department for emergency care, but there's also a percentage of patients who go to the Emerge because they don't have anywhere else to go. So they can have a very minor complaint, or they can have something that's a little bit sicker, they feel like they have a strep throat or something like that. But the emergency department sees a real mixture of non-urgent, urgent, emergent type of cases. So on average, Durham, remember this is an average, sees 20 patients in their emergency department every day, and Chesley sees less than 10. In Durham, less than 10% of these visits truly require emergency services. That's less than one visit a day. In Chesley, approximately 7% of these visits truly require emergency services. And potentially, most visits to Durham and Chesley could be better suited for perhaps family practice, family doctor, or urgent care. So when we look at times, when are people coming to Emerge? What time of day? And surprisingly, it's the same across all 4 of our sites. So it doesn't matter if it's Kincardine, Walkerton, Durham, or Chesley. We're the busiest between 7 a.m. and 5 p.m. And you can see these statistics are from 2022 to 2023. And we chose this year because that was the last part of the year where Chesley actually saw somebody outside of 5 p.m. But you can see the big difference in volumes. So when we're looking at the color on the chart, the royal blue color is Durham. The dark blue is Chesley. The green is Walkerton. And the gray is Kincardine. So what does all this information tell us? Well, we know we continue to face a critical staffing challenge, and we rely on agency nurses. So they are temporary staff, they come and go. They're not committed to the hospital or any site specifically, and it's not sustainable, but they are helping us out and filling some gaps. Durham and Chesley experience some of the lowest ED volumes in the region, and this is difficult to recruit and retain staff. Historically, Chesley and Durham only saw between 1 to 2 patients outside of 7 a.m. and 5 p.m. And high volumes of patients use all our sites for non-emergent reasons and can potentially be better served by urgent care or primary care, which is their family physician. So when we talk about opportunities for the future, what does that exactly look like? Well, South Moose Grey Health Centre is committed to keeping all 4 sites open. We continue to work with Ontario Health, the Ministry of Health, health system partners, and we're looking to maintain and enhance as many services as possible for our communities with the resources that we have. Our goal is to hear from our community as we look to stabilize operations and continue to deliver high-quality, safe access to care. Building on our partnerships with other healthcare organizations and community services, we can ensure families can receive right care in the right place at the right time, closer to home. So when we talk about our partners, we are fortunate that we live in a system of neighboring hospitals. We are uniquely positioned where we have 12 hospitals within a 100-kilometer radius. And certainly we know that people are accessing care at other hospitals for specific conditions or specific appointments. So what are those services? That's what we want to find out. That's what we want to hear from you. Is it for a specialist appointment? Is it for follow-up cancer care? Is it for mental health? Why are you accessing services that are outside of our community, and is it possible to bring them here, closer to home? So when we talk about opportunities, what are our strengths? So we want to look at opportunities to build upon our strengths. So if we look at our 4 sites, we look specifically at Chesley, for example, the first one. What's Chesley's strength? It's the Rehabilitation Restorative Care Program. They have a great program, they do great work. The infrastructure in Chesley supports that type of patient population. They have a strong allied health team, physiotherapy, communal dining, those types of structures to help support that level of care. That's their strength. When we look at Durham, what do we know about Durham? Well, I'll tell you, Durham has a very busy outpatient population. The X-ray department, ultrasound, bone mineral density, outpatient lab, they are very busy. And they're not just busy with Durham patients. People drive to Durham to access those services. And we also continue with our emergency outpatient services as well. When we look at King Carden, that's where the MRI is going to be. That's one of our CT sites. MRI will serve for the region. And when we look at Walkerton, what's Walkerton's strength? Well, that would be the obstetrical program. And we have surgery to back up our obstetrical program. So when we look at our 4 sites, each one is unique in its own strength and has something to offer that we can build upon. So we want to hear from you. As I mentioned, really we're interested in where you're going for your care. We want to hear what you think would help our community and would help serve the community. Bring forward ideas for suggestion. You're residents of the community and you know it best. So just another slide on who we've engaged with to date. So in preparation for this evening, we've had many different meetings and consultations with a few of our partners. And just to name a few, we've met with our mayors and our CAOs, Durham and Chesley community groups, some of our health system partners, which are all listed here, I won't read them all. Certainly our police services, EMS, physicians and staff, our PFAC committee, which is our Patient Family Advisory Committee, and our hospital foundations. And this isn't just an engagement that ends when we finish tonight. This is an engagement that we recognize we have to continue to work with our physicians. We have to work with our other system partners. We have to do better from our communications perspective. And we have to plan for the future together. So there'll be much more conversation happening in order to bring everyone to the table and support our movement into the future. So what you can expect, tonight's about listening and engaging. Certainly with all of our communities. We have another engagement session tomorrow night in Chesley. And we really want to have the surveys completed, so please take the time and send in your survey. Once that process is complete, and the survey, I should mention, will close on September 10th at 4 o'clock. Again, more paper copies are available at the Westbury Municipal Office, and there'll also be copies available at the Chesley Municipal Office as well. Once we get all the results back, we will summarize the results and we'll provide an online report. And we would also like to discuss our findings in a follow-up engagement session. And then once we have that information, then we can plan our next steps and work with our partners. So when we talk about the future of South Bruce Grey, what we envision for the future state after our community services and changes to services, stabilize staffing, being able to stay open and provide consistent and reliable access to care. Less reliance on agency nurses and locum physicians, but we know that's going to take time. The nursing shortage isn't going to end this year, next year, or the year after that. It's many years down the road before we actually will see less impact from a nursing shortage, and we know this. And we'd also like to see improved access to new specialized services that we can provide closer to home. So again, the survey, there's a QR code on our website if you prefer to do it that way as well. So just use your phone to go to our website, or certainly the paper copies are available here and at the municipal offices. Please take the time to complete the survey. And some of the questions that are on the survey: what are the most common reasons you visit a South Bruce Grey Health Centre site? Is it because you get lab work done every 2 weeks? Is it because you have x-rays? Is it because you go to the emergency department? Why are you traveling outside of our region to have service? And recognizing that we're not able to provide 24/7 emergency services at Chesley and Durham due to limited staffing resources, what hours are most important to you to access care? If you're working 9 to 5, it's hard to access care if the emergency department is closed after those hours in those communities. So it's an opportunity to provide your feedback as well. So again, thank you so much for coming tonight. Appreciate your feedback. Look forward to working with the community and working with our health system partners as we move into the future and vision for the future. Thank you.
Thank you, Nancy. Excuse me. We'll now take questions from the audience. And again, just to remind you to identify yourself with your first and last name and the community that you reside in. Jana White has requested to open this part of the meeting. So Jana, we're going to bring a mic to you. And I should have mentioned that when your hands are raised, we will get a microphone to you as quickly as possible. And so we've got some arms up over here to follow. Yeah.
No.
Sorry I had to come to the front. I think that your questions will be taken from your seats, but I thought if I was quick while they fix the mic, that might get some more questions in. So I'm Jana White. I'm speaking today on behalf of the Save the Durham Hospital Committee, which is a group who represents the community. And I want to say first and foremost that our committee and our community remain committed to the return of the 24/7 emergency room and inpatient beds. We have had the opportunity, as Nancy said, to meet with some members of the South Bruce Grey Health Centre senior leadership team and board. And although we are excited to have additional services be brought to Durham, we would like to see that investment be made in conjunction with the return of those beds and the 24/7 emergency department. We do think this is an opportunity for a working group of stakeholders to join together to find a solution. The impact on internal and external partners is far too great, and this decision is way too important to be made in isolation. We hope to have representation from our group, which represents the community, at the table to redesign healthcare that's being provided by South Bruce Grey Health Centre to all of the areas that they serve. Thank you again for the opportunity to speak. I know that there's lots of questions from the community, and I hope that everyone has an opportunity to have their questions answered and to engage in this process tonight. We've been waiting right for this, so let's take advantage of that. Thank you.
Thank you, Dana, for your comments, and I do look forward to working with members of the community and certainly with our team and our health system partners as we move forward into the future. We've had some great discussions, and quite honestly, I couldn't agree more. It'd be wonderful if we could have 24/7 emerge and our beds back. We would love that too. But right now, we continue to work with what we have and the resources we have and evaluate where we are and as we move into the future. So thank you, Jana. Look forward to working with your team and certainly members of the community.
Yeah.
Thank you.
Thank you, Jana. We've got a question over here. Your next entry, patients.
Jerry Grant from Priceville. I noticed in the talk you pretty much avoided the issue of moving the beds out of Durham. And it seems that with the still using a lot of agency nurses, it hasn't solved the nursing shortage. Could you address that?
So working? Okay. Thank you for your question. So you're correct. We continue to use agency staff and resources to help support care across all 4 of our sites. And they do help us. But with the bed situation in Durham, we did not have enough staff and able to staff the bed section of the hospital as well as the emergency department. So between the two, we had to make a decision. The decision was made to transition the beds, 5 to Walkerton and 5 to Kincardine, in order to support consistent, reliable, accessible health care for the emergency department and the community of Durham.
Okay, there's, I think the gentleman in the black shirt was next, and then we'll go to the lady a couple of rows back.
Oh, my name is Don Turnbull, resident of West Gray. And I think at the annual meeting you were saying about development and future population and stuff. Just wondering how much thought, what really went into that, how much research. Because I was able to come up with some facts, and facts that you can get off the computer. In the last 4 years, there was 261 new houses built in Kincardine, 338 new houses in West Gray. Potential future development. Right now, there's over 1,422 lots in West Gray for future development, apartment building and stuff. In Kincardine, there's 636. And Walkerton's worse than that. Walkerton is out of land for development. So you're saying about future, and the average age in West Gray right now is 49.6 years old and growing. So aging. So I don't know what. Do we gotta wait till we get another 1,400 houses built, then we can get our hospital back, or how do you judge that? Is there any thought put into that? Because I'm a developer, and not one phone call, not one question was ever asked. You said you work with the communities. I don't know which part of the communities, the ones that best fit your schedule.
Thanks, Dawn, for your comments. Certainly, the transition to beds in Durham was not related to the growth of the community. It was related directly to the inability to staff them. So recognizing all of the figures that you put forward are accurate, we simply could not staff the beds at the Durham site, and that's why the transition happened. However, we continue to evaluate and see what the shifts what come forward in the future. So when we talk about staff and we talk about the staffing shortage, we know it's not going to end next year. It's not going to end 2 years from now. but eventually we will get to a better place with staff. And as an organization, it's our job to evaluate that and be able to have those discussions as we move forward in time. Thanks for your comments, Don.
Yeah, I think there's a lady with her hand up right in the row behind Mr. Trumbull, and then I think there was someone behind that. So go there, and there's an arm up here next. After that.
I am Julie, and I live in the town of Durham. I just want to know, you keep continually telling us that staffing in the Durham hospital is a problem. So, how many RNs have you hired since April, when the staffing shortage came to a crisis point? And how many of those RNs that you have hired have been attached to the Durham site?
So thanks, Julie, for your question. Our Human Resource Department continues to work, as I mentioned in our slide deck, around recruiting and retaining staff. Certainly, the changes that happened in Durham, I believe the date was April 23rd, that we made the announcement around the transition of the beds, and the beds were transitioned on June 3rd to the other sites. Knowing that right now, we would need numerous amounts of nurses, not just in Durham, but across all of our sites, in order to build redundancy into our schedule and be prepared to address any vacancies that come up. So right now, anything at the Durham site would be posted and we would be hired into. I don't have those exact figures right now, Julie, but certainly that is information I can add.
Okay, there's one more. Yeah, another question in that same area, and then we'll come over here.
Hi, my name's Darlene, and I'm also from Westgrave. And Nancy, you do keep reiterating about the staffing is the very problem. But I want to know, we lost all the nurses that were taking care of the inpatients. Why do we not have at least, at the minimum, 24-hour emerge? Where did those nurses go? They could have come from the floor to the emerge.
So thank you for your question. It's a great question. And what we need to understand is that those nurses are still there. So that is, we had a shared model to some extent, that there was nurses staffed in emerge, and there was nurses also on the inpatient unit. And they would help out from the inpatient unit when needed in emerge as well. But we had over 40% vacancy rate. That's where the nurses are. We don't have many nurses left in Durham. So to understand what the difference is between the two, that is why we couldn't staff both inpatient and the emerge.
You mentioned sick calls. I know 12-hour shifts are really hard to cover. Did you consider 8-hour shifts, going back to 8-hour shifts? When an 8-hour shift is a sick call, you can get overtime from day shift to cover 4 hours, and the night shift, like 12-hour shifts are really hard to cover.
Durham has a committed group of nursing staff that are amazing. They really are. They have done so much and have gone above and beyond to provide care for the community of Durham. And many different HR conversations were completed, and certainly those discussions were completed with HR around any kind of scheduling strategies that would help support, but there's simply just not enough nurses.
Okay, we have this gentleman with the ball cap on, and then we're going to go to the lady over in that first section.
Hello, my name's Peter Stadnick. I'm from the Durham area. You mentioned a lot about the big thing is staffing. That's really the heart of the issue here. Is not enough staff. And you had said we have to adapt. We're doing everything we can and making our best efforts. Now this is an idea that I brought up 2 years ago to the previous CAO. I brought it up to you recently. We had a private Zoom call. And it's an action that other places have taken to solve their staffing success. It's an action that's been taken by every other province and territory in this country. It's an action that was taken by the hospital near Midland. And closer to here, it was an action that was taken at the Bruce Lee Long-Term Care Center. And that was to hire back the healthcare staff that didn't get the COVID vaccines, and they make them all eligible for work. No other province does this. We're kind of alone in this. And not only that, there is unvaccinated staff working at the Walkerton Hospital. This was before your time, of course, but when they went to get rid of them after 2 weeks, well, they lost their labs, so they had to bring them back, and out of necessity. So I'm seeing a glaring thing. You spend 3 times more money on agency nurses trying to solve this. You could have 3 staff. Like, there's thousands of nurses that are unemployed right now, and none of them have become welders, sought other careers, because they have no hope of coming back. My friend Anna, she lives in this area. She works at Bruce Lee, where it's the only place she's allowed. She would work at Durham if she was allowed. And other hospitals in this province have revisited that decision to solve it, to give care. And I would ask to you, if this is, we're doing everything you can, would you not consider making that decision between you and the board to solve our staffing crisis?
Thanks, Peter. That's a very commonly asked question around vaccine, and certainly it is a topic that has been explored. And we have seen COVID outbreaks in some of our areas of the hospital, and we know that COVID is still out there. So as an organization, we continue to follow evidence-based practice and suggestions and recommendations from infection control. So those are the best practice guidelines that we're given, and as an organization, we are responsible for a vulnerable population within our hospital. So we remain committed to following that path right now and following the recommendations of the experts.
Which organization was that you follow the recommendations of?
There's many different ones, so certainly for the province. So we have our public health agency that Dr. Kieran Moore is currently the medical officer of health, and those are his recommendations as well.
Have you asked the director of care at Bruce Lee why they made their decision to change?
No, I did not, because we're a hospital and they're a long-term care facility, so we're in different ministries.
What about the director of care at the Midland Hospital?
Last counter question, and then we're going
Okay,
to
well,
follow up.
the director of care at the Midland Hospital, what?
So what I can tell you, Dieter, is that I do talk to other CEOs of other hospitals as well, and we do have these conversations, and we do regularly review vaccine guidelines to make sure that we still are following a standard and doing what we need to do as an organization. So those conversations do happen on a regular basis.
We have first of all, the lady that has her arm up, and then we're going to come back to someone that's been waiting here, and then back to that gentleman. Thanks for your patience, everyone.
Hi there, my name is Brenda Scott and I'm from Chesley, which means we haven't seen you since October 2022. It'll be refreshing to see you there tomorrow. My question is concerning this survey. This survey is a shameful, biased, ill-formatted questionnaire that doesn't allow people to choose the biased document is one that is formatted in a way that you can only choose particular answers. You can't give an open answer. So question 6, let's look at question 6. First of all, you admit that you can't provide 24/7 service in Chesley and Durham. Thanks for admitting that. We knew it. And then you go on to say, what other hours would you like? Like we were standing on, so I'll have a chocolate milkshake instead of a vanilla one. We don't want part-time ER. What part of 24/7 do you not understand?
Thank you you, Brenda, for your comments, and thank you for your passion that you bring to healthcare and for your advocacy around healthcare and maintaining healthcare in rural communities. You should be commended. It's very important, and certainly that's why we're here tonight. So when we talk about what kind of services you'd like, what we're asking is, we can't staff 24/7, you're correct, but what we can do is perhaps provide specialized services in partnership with another hospital. So what that means is we're talking about one nurse to run a clinic versus nurses, many of them, that are required 24/7, 7 days a week. So there is big difference there in the amount of staff that you require. However, it was a great question, and thank you, Brenda, for everything you do.
Hi, my name is Jerry Grant, the other Jerry Grant. I have a question. Both Ms. Shaw and Mr. Dunn, you said that you're not closing the Durham Hospital. Could you please describe to me what this open hospital looks like? To me, it sounds like an urgent care with a little bit of lab attached to it. So what does an open hospital look like to you?
So the open hospital that we have right now in Durham, we do have an emergency department that is open. We also have outpatient services, x-ray, lab, ultrasound, bone mineral density. And what we're asking is if there is a potential to partner with other organizations, what kind of services would be appropriate to bring to Durham that the community would be interested in seeing.
I guess my whole point is, I thought hospitals by definition looked after people and were able to look after them in that site. As I say, this sounds like an urgent care facility and labs.
No, it's a great question, Jerry, because when we think about a hospital, that's what we think of. We think of patients in beds. So it's very different to look at a hospital that doesn't have any inpatient beds. But it is still a hospital. So right now, this is what we have. This is what we need to work with. And we will continue to maintain what we have as we work towards the future and vision what the next steps will be and where we will go from a service provision. So right now, we're doing what we can with the resources we have. It doesn't mean that 10 years from now things won't change. But right now, where we are, we're working with what we have.
Gentleman with his hand up over here.
Hi, my name is Gerald Browning. I've been here since 2006, retired here from the military. One idea, you want staff, how about paying for some of the students nursing that are going through, that have to pay for the fees and everything else? What about paying for them when they pass? The military's been doing this for decades. They'll train you for a period of time and you have to serve 5 years. Minimum. Either the government start paying and helping out these students and getting more students to go through, or the community, and they have to serve in the community as helpful.
That is a great innovative idea, and those are the types of ideas that we need when we're talking about change and adaptation and using those types of words. But right now we're in an environment that is unionized, and that's the piece that I can't control. So if you want change at that level, that's something that is from a provincial lens, and that's well, we'll have to have discussions outside of this engagement tonight, because that's out of my control, unfortunately. I don't have that kind of ability to change those rules, but not saying that that can't be done, but I'm just saying that it's bigger than an organizational decision.
And up over here, somewhere left.
Hi, I'm Angela Shank, Angela Clark Shank, grew up in Durham, lived here more or less since 1969 with a little blip. Here's the thing, geography is a funny thing. And when I look at that map that you had up there, and it shows Kincardine, it shows Waterloo, it shows Chesley, and they're all in Bruce County. Kincardine is not even in the center of anything because it's along the lake. Durham's in the center, but we're also far away. And when you chose to take our beds away, you didn't close those beds. You moved those beds. Those beds still have nurses attached to them. They still have patients in them. They just aren't in our community. They're in Walkerton, and they are in Kincardine. So when you talk about there being a shortage of nurses, there's definitely a problem with the allocation of nurses. But I question seriously what the shortage is, because you still have those beds. Somebody's getting the privilege of them, but it isn't anybody in this room, because we have become healthcare refugees. We go to market, we go to market, we go to You took our beds, you took our excellent staff, you took our community and you moved it far away because you knew damn well none of us were going to use your services. You got to take what we had, and you knew somebody else was going to have to pick up the pieces and provide the health care that our community needs, and you don't care.
Thanks, Angela, for those comments. And I do not live in Durham. And the community here can still access health care. Unfortunately, and I empathize with you, I do. The ability to absorb staffing in a larger hospital is easier. So when we transition the beds, and somebody calls in sick at one of those other sites, they do have a larger pool of staff that we can draw from. And so that helps support the delivery of care. So we can't have patients in beds in Durham when we don't have anybody to care for them. So that is why that decision was made. And I know it's difficult, very difficult for the community of Durham to see that change to their hospital, recognizing that it is such a big part of the community. And it's not something that anybody wanted to do, and it was not a decision that was made lightly. But faced with the situation that we were given, that was the safest choice that we could have to provide care for our patients. You're right. When you look at Durham on the map, there's many options for this community. There's many options of different hospitals that you can choose to go to, and that's your choice. So it's not part of what we're telling you to do. If you live in Durham, you might be closer to Markdale. You might be closer to Hanover. You might be closer to Walkerton.
So can our beds go to Markdale and Hanover?
Yeah, why don't we send the beds there then?
Yeah, Anita had her hand up over there, I think in the black top, yes.
My name's Shalane Goodwin, I'm from Durham. I'm just curious, when you keep talking about improving the staffing, there are no options for staff to come to Durham. We're developing more in Kincardine, you're filling all of the other sites. So how are your recruitment working to fill opportunities in Durham that are not there? We don't have 24/7 staff anymore. We don't have inpatient beds. So how do we improve that situation? There's no openings for those nurses.
Thank you for that question. It's a question that I do hear frequently. It's a good one. So what happens is that with staffing in Durham, this is not a new problem that happened this year. It's not a new problem that happened last year. It's been going on for quite some time. We have had postings up for many positions that have never been filled. This is not new. This is something that we've been experiencing for quite some time.
Okay, I know there are other arms that have been up. So lady in the center of that section there. And I saw an arm over there.
I'm curious how much more funding you're getting then at the Kincardine Redevelopment Committee for all the renovations and upgrades, a whole new hospital you're building there with the funding from our beds.
So redevelopment of the Kincardine site is something that's been in planning for some time. And certainly that is, we're funded for the redevelopment. The municipality has to fund some of that, and certainly the ministry has to fund some of that. So we're funded as an organization as well. So it's not that we're taking funding away from Durham in any way.
At the back on that side.
My name is Lise Lott and I'm from Durham. You just mentioned about emergency services, we could go to Hanover. In your statistic you showed that Hanover has the highest amount of emergency patients, long waiting times because of that, probably also understaffed. How do you see that happening?
So thank you. What I was simply responding to was the fact that a comment was made around the use of the Markdale Hospital. And what I was just simplifying was that patients have the right to choose where they want to go to get care. And sometimes that's closest to you. So you do have the ability to choose where you would like to access care was the only statement I was trying to make.
It was, front row over here, or, no, not the front row, but.
I'm Mark, and I've been in Durham forever, or just outside of Durham forever. I was chair of the Durham Hospital Board when the new arrangement was negotiated. We spent a lot of, I just mentioned to Mr. Jacob tonight, how many times we drove to Kincardine in snowstorms. One night, I just didn't think we were going to be home at all. We worked hard for that agreement. So you can know how disappointed I am in the leadership of the hospital and the present hospital board, especially the so-called Durham representation. So I'm not. I have been lucky enough in my life not to be in the hospital too often, very published about that. But last year I had a bad year. And I was in 9 hospitals for tests and procedures for specialists. I did not have one complaint about that. When I was sent to Trauma General, I was happy. I knew I was getting good care if I went to Trauma General. I expected. And I was in hospital, in labs and tests in Hamilton. I did not complain about that. I was happy that I was being looked after. I do not think you hear us saying, we don't need specialist service for everything because you need specialists. We need 24-hour service and we need beds. I had the pleasure of being driven from Durham to Hanover one night and back to Durham the next morning. Spent 2 nights, and when you're sick, you don't really want to drive to Hamilton, or we don't want to go to Kincardine. But I don't think you hear us. What we want is 24-hour emerge, and we want beds and I don't need any answers. I don't want to go to the next question because we don't need any more baloney that we're getting tonight.
For one more question, I know that I have missed some of your arms, I'm sorry. this lady, out in the middle of this section.
Ladies and gentlemen, my name is Harriet Mitchell. I'm from Durham, mostly. And having spent a good part of my career in work that engaged the public, I would just like to express a couple of points of view about that. First of all, I think almost everything that we've talked about here tonight has been completely unnecessary. If your board does not understand how to engage the public, the lives that they are impacting with what they're doing, there's something very, very wrong. Sorry. There's something very, very wrong with the organization and its culture. So that's the first thing. Also, just to turn things a little bit toward the future, as you've tried to do so much today, having waited 5 months for this meeting, how long could we expect to wait for some result of this meeting? And I don't expect that you have a plan in mind yet for how you will gather community input. But shame on you if you don't. Because you have a community of concern, you have a community who feel threatened, and you have people who have lots and lots of good ideas to which, up to this point, you've been unwilling to listen. So, when and how are you going to gather the very valuable input that sits in this room and beyond and use it in some fashion to help our predicament?
Thanks, Harriet. Part of what we heard earlier was some comments made from Jana White and representing the Save the Durham Hospital group. We have had some good discussions. We plan on continuing those collaborative discussions. You're right, it's taken far too long to have the discussion tonight. Absolutely. There's for many, many different reasons. There's a few different reasons. However, we're here now.
Share those with us.
We are here now, and we are having conversation. We are asking for your feedback through the survey.
We've done that. We've discussed the survey.
Okay, there's a lot more people to hear from, and it's going to be open till September 10th. It's not going to take another 5 months, I can tell you that, Harriet.
Are you going to change the survey?
Well, the feedback we've received to date, we've actually had a large number of surveys come back already. And we're sticking with the survey right now, and we're going to see what the feedback.
Biased as it is.
That's the feedback we're going to get. And we will share that feedback with the group. And that's part of what we're planning on doing, and sharing that feedback, listening to you when we share the results, the analysis of what we've learned, and we can carry on these types of conversations. But our hope is that it's collaborative, and we can continue to communicate not only with the community, but we also need to work with our health system partners, because we need to all work together.
We would love to work together with you. We've been asking to work with you since the 28th of April.
Yeah.
Number 1.
Thank you, Harriet. Thank you, Harriet. And I am committed to working with the community, and we will be working together. We will be having more discussions.
So how long could we expect before we have this group formed, and how are you going to form the group?
Well, I don't have those answers right now. The survey is closing September 10th, and then we'll have those discussions. And I know that Jana is going to be working with us as well, and we can have those conversations. I don't have those answers right now, Harry.
You have confirmed our thoughts about coming here tonight.
Thank you. That concludes the Q&A session. Nancy does have some prepared closing remarks. Dean's going to comment as well. Thank you, folks.
Why don't we do our own survey and send it in and see if we get response? It's true. Send a survey in and see what kind of response we get to our questions. That'll tell you.
We would vacate at 7:30, and keep up with that commitment. We are going to wrap up the meeting.
I think the arena will let us stay.
So as I mentioned earlier, we will be back. We will be having more conversations. So on behalf of Southeast Spray Health Center, I would like to thank you for coming out tonight. It's the beginning of our conversations as we move forward into the future. Your dedication to improving healthcare in our community is clear. And thank you again, Claude, very much.